Yeah, good morning. I really today want to help you know the kits. When I talk about the kit, I talk about the drugs that are required in the seasons because we have two seasons here. We have the rainy season and we also have what they call the dry spell. So today I think I will have to inform you about the rainy season because we are in the rainy season. How do you really need to handle your animals in the season of the rain? I think you see my animals are not really looking bad. That means I'm really doing somehow good job about handling the animals in the rainy season. Rainy season is very good because we be with a lot of grass, but most of the grasses we have, it's always fresh. And I've mentioned in many of my videos that the rainy season, the wet season, is having its own challenges, and of which now those are some of the challenges that we are going to talk about. And as we farmers, how do we equip ourselves in that season? So basically, today we are going to look at the kit, the medical kit. We call it the medical kit that really helps us to achieve in this business during this season of the rain. So I'm going to show you some of the drugs that we really have, because as a good serious farmer, you're supposed to know all the seasons of the rain. What you see those guys are really doing, they are separating the old goats with the old kids. Do you see now the kids which are used to stay in the kids section? They are trying to separate themselves, coming up. Those that stays up, I think you see the old ones are going back, but the kids are now coming up here because this is where they are used to stay in. I think you see the guy is just clapping, and those which are still young, they are sorting out as themselves to come up here. Those are the ones of 2 months and 1 month. All in all, what we need in animals is that shiny skin, like this. I've told you many times that some animals have a very strong mechanism. You see, this kid is 2 months old. So that fur you see is not because it's communicating to you that it is sick. It is not. But in its mechanism, when the coldness is much, these animals tend to put on a lot of hair. And during the sunshine season, they always try to wear off the feathers go off. But this is a very good example that these animals are healthy. So the kit I'm going to explain to you is what is making this. How do you make your kids look so adorable, having those body score like the way you see? You see the pelvic quarters are really holding a lot of muscles. How do you do that? That is what I really want to tell you, because this season tend to challenge a lot of people. But me, I want to break up all your challenges into a very simple, practical experience. This is all done by uh, really by the kits. As I'm going to show you the drugs that you're supposed to have. You must know the seasons. Yep. Chirabai, now I have promised you that really what we want is a healthy looking goat. You get, this is a rainy season, and many of you have been challenged. You've been challenging each other that the rainy season is a season of kids dying. Hamisa, I don't believe in that. Me, I believe in producing an animal and it grows. I think now when you look at these guys, and also I want to take off that mentality that the more you go towards purity, the more mortality that you get. It is not the case. The science behind this is knowledge. How do you manage? How do you handle animals? So look at this goat. It's in the rainy season. I think you can leave it. You see, it has a very good body score, though not that very nice. like the way I would love my animals to look, but I'm trying. Remember, I am not I'm not feeding these animals extra. No, I'm just giving them an ordinary feeding. These ones, this one, I think it has made 2 months now, but it's feeding on milk only, nothing supplementary that we are trying to do. So basically, I think you look at this animal, it's not looking bad. Um, you look at this, it's not looking bad. These are high grade animals and these are pures like the way you see them. But actually, they are doing typically very nice. The question is, how do we know? How do we try to manage these animals? We have some drugs here that we have. This doesn't mean that these are the only drugs that you're supposed to have all throughout. No, you might have different drugs, but still, this is what you have to know. There is a lot of drugs in the market, but I wanted to show you how we get organized in the rainy season. Um, One, this is a vitamin. This vitamin is called Ulceril. When you look at this, I think the cameraman can bring it much closer, such that you try to see some of the ingredients that we have in that vitamin. This vitamin is nice. I don't say that this is the only vitamin that we can use, sorry, but there is a lot of vitamins that we can use. But when you look into this, there is a lot of vitamins because these animals, I told you, they get affected with a lot of infections, and most of the time are clostridial infections. And this, when you look at this vitamin, it's very good. It has vitamins, a lot of vitamin A, vitamin D, E, B, B2. It's a lot. But when you also look at its different side, there is some ingredients of antibiotics that are also in this, like streptomycin sulfate, that works definitely a lot on the diarrheas, on a lot of things. So in your kit, have some vitamin. The reason why you have to have some vitamins, I told you in a dry, sorry, I have some flu a little bit, but doesn't stop me from teaching you. So I told you, like in the drainage season, there is a lot of bacteria. And why the bacteria are many? Because they really live in soft areas, in a very soggy areas. It is a habitat of multiplication of bacteria, of infections, but in a dry spell, they all die. So that's why we must have, so these animals, they go feed out. The mothers go and they stay. So when they stay, we give them, they are the ones that first get the water. So when the mothers go, we have troughs where we put their water. So we put in ulcer rail so that it can help us to clear those infections that always come, and also giving them vitamin. Vitamin really increases metabolism of the body. It helps them how to utilize more feeds that they eat, and also having the body immunity. So have Ulceril in also your kit. Not only this, but there is also Introvit, there is Aviboost, there is a lot of vitamins, but look at what is in that vitamin. You can be intentional that I'm using this vitamin, but also having some antibiotics, which is very good. So in your kit, in the rainy season, don't forget to have oxytetracycline. This is like Panadol in your kit. This shouldn't go off your drugs. I don't say that only use this brand. There is a lot of brands, but this is Oxy 10%. This Oxy 10% most of the time is a bacteriostatic drug, but it's a short acting. It works very fast than this Oxy 20. Some people confused that, like, when you use Oxy 20, it works more better than the Oxy 10. The issue is, you see this LA, long acting drug. It takes long to be activated in the body and it stays longer in the body. This works very fast. It is 10%, and 30% stays more longer in the body, and it's not because it's much stronger. So in some cases, like those abrupt death that always we get, basically we can use Oxy 20 because we don't know what is happening in the body. We don't know the disease. An animal doesn't show us clinical signs, but animals come back, have sudden death. You can try to put this into the body of the animal, such that this antibiotic is there. Just in case there is a hidden infection that we don't see, this drug will take longer, the Oxy 20 will take longer in the body, so that in case there is something we don't know, as you continue to do the investigation. So in your kit, have it. You can as well have some iron. Most of the time, some animals become anemic. We always have some diseases like cysts, hydatid cysts. We always have worms, and those worms survive on the blood of the animal. So this helps to give more blood supply. It helps the body to manufacture more blood. You get it? Such that the animal does not become anemic. So in some cases, some animals which are too weak, you try to support it. You try to check, we always check the membranes, always check the eyes to see, is this the normal color of the eyes of an animal? Let's say if we try to check this, this is pale pink. That means this is a normal color of the membrane. But an animal which is anemic, you find that the whole of these membranes are white. It's showing to you that it doesn't have blood. And when we check here, you see pale pink. That means this animal has blood. So if it doesn't have blood, it is white. So that's when you need ferrum or you need irons. So basically, sorry, in your kit as well, you also need that iron. If you can, keep it there. Then also, let me show you more other drugs. This is dexamethasone. There is calvasone. There is a lot of drugs which has dexamethasone. This is an anti-inflammatory. So an animal, let's say it has nasal discharge. What this helps to anti-inflammatory. It diffuses if there is an inflammation in the lungs. Whenever you see nasal discharge, just know that there is an inflammation in the lungs. So if you give this animal this drug, it will help to stop that inflammation of the lungs. So this is a supplementary. Let's say if we inject Oxy-10, and then you can as well give some Dexa or this anti-inflammatory or calvasone, it will definitely help it to heal much easier. Also, in your kits, you can as well have more drugs. This is Maltstar. So this is an injection. This is an injectable vitamin, which is also very good. I told you about the vitamin. This is vitamin, but this is oral and this is injectable. Sometimes some animal doesn't take, let's say it's not taking water, it doesn't want to eat. So you cannot give it oral because this is optional for it. You can use this injection, you measure your meals and then inject it there and then. So it can force it to eat like it or not. So this is Gentavet, this is gentamicin. We always have a lot of diarrhea during the rainy season. If there is a lot of diarrhea, please, this is a very strong antibiotic and it's very good. It can as well stop diarrhea. It does a lot of secondary infections in the body of your animals. So have Genta with you. It does a lot of things. I can't explain all these. Pharmacologists, of the pharmacists can really explain a lot about this, and different vets can as well explain a lot, but have it in your kit as an emergency. So pen and strap, because during this season of the rain, we do expect a lot of bacteria, and bacteria causes a lot of inflammations. We call it abscesses. So after, let's say, opening that an inflammation, because for us here we do everything proper, that's why you don't see those kind of infections, but expect a lot of the abscesses, a lot of boils. Why? Because bacteria are very rampant during this season. So have your pen and strip. It's a very good antibiotic. So in your kit, Theosin. Theosin is also a very good antibiotic. Very good. This specifically deals with respiratory infections. Nasal discharge, cough. Also have it in your kit. You see, this is the same as this Dexa, though this is a different trade name. and this is different trade name, but these are the same, all anti-inflammatories. Sometimes this is a drug called ascarten. It's always good for dogs and cats. When you're deworming your animals, please try your best to make sure that you also deworm the cats, the dogs, because dogs and cats, they always have that disease, that worm called hydatide cyst. That cyst also attacks goats. Sometimes when you find that these goats are already diureting, you've dewormed using different dewormers like this liver fast diamond, the diarrhea is continuing, and most of the time we advise you, when you have your animals and they are really having strong diarrhea and you suspect worms, don't use liver fast, because liver fast, it brings diarrhea. So you better use injectable dewormers. So if you deworm your animals, it's diureting, you give it injectable dewormer, it is not stopping. You've given maybe albendazole, it doesn't stop. You've given sulfates like maybe bacillin and so on, and there is no response. Just know that there is a worm that you've not hit. What do? Try and give this ascarten to your dog, sorry, to your goat. You might find magic in it. I know it is for dogs, but sometimes we give it for goats. Why? Because we are specifically targeting those cysts that always attack goats, and they are mainly attackers of the dogs. So in your kit, also have this kind of drugs. It's a dewormer anyway, and this is called a hypodermic syringe. This is what we use to inject. You draw the blood, sorry, you draw the drug, and then you do the calibration, you read, and then inject. So my dear farmers, I was talking to a guy, a senior, sorry, breeder from South Africa, and that senior breeder was telling me, Hamis, people think that doing farming in Uganda, you're supposed to be a vet, which is not the case. Like 90% of South African breeders are not vets, but they can know those basic treatments, because looking for a vet from a different, let's even be here in Uganda, a sub-county vet is driving over 30 or 50 kilometers to reach at your farm. So if you have a goat which is worth 7 to 10 millions, you call him, you're not able to have a vet on your farm. By the time he reaches, the animal has already died. So basically, that's why we need farmers to have that sense of humor, that when you have animals, have a basic treatment. Like the way you see in a human, every family, most of the time, they always have some malaria tablets. They always have um, panadols, drugs which works for stomach ache or something. That is just an emergency. So basically, that's what I really wanted to inform you, that during the rainy season, those are the kind of drugs that you need. You've seen all of them are working towards bacterial infections, are working about those dominant infections. They are related to diarrhea, you get worms, and you find that in a dry spell, that is not what you'll find. I'll try to show you the kit that you might have during the dry spell. You guys, let me just wish you the best. I think that is enough for now. I have some flu, but don't worry. I'll be fine, and I really want you to understand this, because me, even if I die, this information will stay and will save more other people's money, because that is my dream of you guys saving your money. Don't lose the animals because I told you I can't help you out. Thank you so much, and let me just wish you the best. Bye.